Last year, I had the opportunity to talk with and to meet with some individuals from Virginia Commonwealth University Hospital at Tappahannock. And during some of our conversations, I began sharing information about my lack of confidence in being able to meet the needs, the healthcare needs of people in our community. And of specific importance, we were dealing with health disparities, especially as it relates to people of color. Although we want everyone in the community to receive the level of care that's needed, but it seemed as though people of color are often holding the short end of the stick when it comes to health care and having those needs met. So after engaging in those conversations, I had the fortune of meeting Mr. Tyler Agee, who is with VCU Tappahannock. And we began an effort beginning with the Northern Baptist Association last year, or early this year with some of their meetings, what have you, but then we kind of expanded it a bit. But as a result of those conversations, we realized that we needed more partners. So we began making phone calls, talking with the Virginia Department of Health, the individuals with Into Health, also talking with the Free Clinic and Bond Secure and others to see if we can identify where the areas of deficiencies are, but also to collaborate, because there's not one or two people who have all the answers or know what all is going on. So as a result of that, this gentleman, Mr. Agee, has been a superstar in helping to pull a program together to address those issues. So I'm going to invite him to come and share with us tonight.
Thank you so much. That was quite the introduction.
Just send money.
Pastor Williams has been the true champion of this work, and we're excited to be with you all. So let me just get these slides up here. As Pastor Williams teed up this conversation, we really would love to kind of do 2 or 3 things with you all, depending on the time. We have spent the last year working together to engage residents, to engage stakeholders, to engage community leaders, anyone that we could get in front of and be with, to understand from their perspective, from each of our unique perspectives, what are the health needs facing our broader community? So while we're based out of Tappahannock Hospital, and I'm part of the VCU health system based out of Richmond, but really serving the whole Commonwealth, we're looking at the larger, Northern Neck, Tappahannock region when we talk about our community here. So we want to share just the results that we've heard from community members. These are not our hospital's thoughts on what are the needs, but are truly either direct input from a community member or something that's publicly available data that we'll share with you. So we want to talk about kind of the identified needs, a little bit of a framework that was just nicely articulated around addressing health disparities. That's the approach we're taking as we move from identified needs into what can we do over the next 3 years together to really move the needle and improve the health needs of the community. And then whether we can do that today here, or we have lots of opportunity, and we're really looking for invitation to come and speak with your group, to be with you, and really explore partnership opportunities. We know we're one hospital in a large region, we're one health system. We want to continue to figure out ways that we can bring partners together and do this work together, because we know there's so many great assets in our community. So that's what we'll try to do today here quickly. You don't really need to be able to see this whole graphic, but the wheel is essentially the formal community health needs assessment process that we've been going through. And the check marks just show you we're about halfway. We've done the kind of needs identification part of this, and I'll just say transparently, that's a snapshot point in time of needs, and it's only as great as the number of people we were able to reach and the communities we were able to reach. We know this is not totally reflective of our whole broad community, but hopefully serves as a nice snapshot of what we've been able to learn from speaking with folks. We're in this prioritization process because we know as a hospital team and as a health system and even as a community, we can't possibly spread all of our resources thin to address every need at once, but can we do some prioritization? And we're going to share kind of our thinking on that and would love feedback from this group. And then the rest of the process is really developing strategies. We want to have partnerships. We want to create new access points. We want to expand the work that we're doing. A lot of the initial conversation here was a great kind of framework of, yes, there are opportunities and how can we work together to address those. And then putting together a formal plan that's documented and shared with the community and revised ongoing in a continuous way. Really small to see here, and I'm sorry for that. But there's 4 main buckets of needs that we have organized based off of, again, what residents have either told us through the surveying, focus groups, community conversations. Northern Neck Baptist Association is a great example. And we've bucketed them into 4 areas. So the 4 areas are access to care. That includes primary care, dental care, oral health, mental health, and specifically access to specialty care was a common theme, especially in our rural community. So that's one area, access to care. Another, health disparities and health outcomes. And everything that's on this list was either a known disparity based off of publicly available data. So for example, in this community, in this region, there are poor health outcomes around chronic disease like heart disease, diabetes, hypertension, compared to the rest of the state and the rest of the Commonwealth. Poor health outcomes when it comes to maternal and infant health. Poor health outcomes around morbidity and death, around accidents, cancer, heart disease. And so these are known disparities that we're trying to develop and strengthen partnerships to address over time together. So that's the second bucket, health outcomes and disparities. The third is around mental health. This was something that is probably not surprising for you all, something that we just heard again and again and again, and that's school-based mental health. It's adults, it's children, it's drug use and overdose. It's creating spaces to support patients and residents around depression, anxiety, suicide, et cetera. And then the fourth area are those social drivers and determinants of health. So your income, your education, your access to healthy and affordable food, housing insecurity, just being in a rural community, knowing that transportation is a real barrier to access, and violence and safety. So those 4 areas are how we kind of frame the needs. And I'll pause there just for any initial reactions when you think about the health needs in your community. Do these 4 areas seem right? Are there things that maybe are missing that aren't on here that should be captured? But how do these 4 areas sit with this group?
My concern is, I think you got all that right, but there's so much that's available online now, so I think that gets into a different area. What is the extent of wiring and availability of online services in all these areas to people in our community?
So going back to that, how can we use technology to expand access? What about others? Any other reactions to this graphic here?
Come on, y'all have never been to back to it.
Well, I think it's very complete. I mean, we're fairly new in this area, and we spent a lot of our lives in Alexandria, Virginia, and have a lot of doctors and healthcare providers who we used up there. And I find that I go back to Alexandria. I just had to have a root canal, and I've never been so glad to see a dentist in my life. But I went to Alexandria for that. And I went over to Mechanicsville, which is probably where y'all were talking about the closest maternity ward, maybe, is that Mechanicsville? But I went there for surgery and PT, because what I needed, was there. So I think access and specifically specialty care is clearly up there in Florida.
Great, thank you. Yes, sorry, over here.
I think it's a thorough list. However, I always see the weakest link as education and making a long-term plan. How do you involve parents in educating children at an early age to prevent a lot of these things, a lot of these outcomes? And then I would say also poverty, the direct impact of poverty on access to information and solutions.
Absolutely, and that health education piece gets into kind of this next phase for us, which is how do we help and partner together to make that a reality? How do we help get information into the hands of people early to do exactly what you just said? And so that's one thing that we're kind of thinking about and would love to engage this group further, another day after this, but just to see how we can do that together and create something. If it doesn't exist, create something new. We'll come right back to you. There's one.
My comment was around the same lines as this lady's, and it has to do with health literacy. I worked downtown at FEC for 30 years, but I have lived in this community for 40 years. Volunteered at the free health clinic in the past as an RN. And so I see very often that people just don't understand. And there's not always a lot of time to teach people. So health education is extremely important to know what to do. And there's also a matter, if we're talking about racial differences, and there's a trust issue, a huge amount of trust. When you look historically at what has happened in the medical system, why would a black person trust enough to say, oh, sure, you can do research on me? What has happened in their past? So that's an area that I'm very passionate about, is trying to help build trust for individuals of color.
Thank you very much. Yes.
I think it's a good list, but it's also a very general list. In talking, for example, about transportation, if you're thinking of transportation to appointments, that's one thing. Transportation for emergency medical is something else, because I think a lot of us look at the hospital here as triage. And you go in there for an emergency, and getting from there to where you're to being moved, you wouldn't believe the number of steps you run into. And I've experienced this. Do they have a room available in Mechanicsville or St. Mary's or any of the other hospitals in the area that are capable of doing what needs to be done? Is an ambulance available? Do you need something faster? So I think they're getting down into the nuts and bolts of some of this is going to be extremely important, because right now I don't feel like we can get rapid, high-level treatment here, and sometimes people I hear are tempted to skip stopping at the emergency room and just driving to Richmond, and that's pretty scary.
Absolutely.
Do we have anyone from Bon Secure here?
Yes.
I wanted to make a comment simply because I take someone to their general appointments every 4 to 5 months, and we go up to Mechanicsville. And this particular person has rheumatoid arthritis, and it's something that we have an elderly population here that many people are experiencing. So why don't we have specialists somewhere closer that I don't have to drive 2 hours, because she can't drive on her own
Right.
in order for her to get the care that she needs.
Yeah.
If I may,
Please.
I reached out to various health care organizations, including Bon Secure. I met with the gentleman who is supposedly their administrator about what we are striving to do. And I invited him to this session. At the time I met with him, I impressed upon him the persona of Bon Secure in this community. Not only the lack of medical care that's available, especially like dealing with maternity and what have you, but I also didn't pull any punches, but I let him know that even though the hospital is under a different name, there are the majority of African Americans in the community have made it known that they would rather die than go to that hospital for treatment because of how they've been treated in the past and the lack of professionalism in care, which I felt was important that he needed to hear, but also be a part of trying to address the health disparities issues. So, believe me, he will know that he missed a grand opportunity to be here to hear what's going on. And I'm hopeful that he will avail himself to be a part of this movement, or this initiative, because it is very much needed, because it can only enhance the medical care available to the people in this community. So I will ensure that he knows.
Thank you. Yeah.
Make a little comment on that.
Yes.
I'm not making any excuses for him or anything, but he was supposed to come to my house to meet Leslie Mehta as well, and he just had surgery, which was why he should make his own excuses.
That's
Yes,
why,
I know.
that's why I have folks.
But maybe, you know,
Well, I'll
one
give
more
him
chance.
we will give him an opportunity, okay, to address that.
My question is in providing, as was implied, younger or people who are going to stay here longer in healthcare. In North Carolina, they forgive cost of your education. And my daughter is a dentist in the poorest county in North Carolina because she was able to take advantage of that program where they forgive your debt because you practice in an underserved area when you graduate. Is that available here in Virginia?
It is.
I think it is, right?
The dental does it, also
Yes.
the state does it, and there's a federal. You can't get them all three at the same time.
Right.
But actually, would your daughter like a full-time job here?
My local,
Close to mom.
my local dentist has already tried to recruit her.
Keep working on it, Mom.
She's practicing with her dad, so.
And those of you who may not know, this is Jeannie Nelson. If you don't know her, she's at the Free Health Clinic, and she's actively engaged in this process with us. So we're so glad to have you and your compadres.
This is John Wilson, actually everything. He does everything. And this is our medical director, and over there's one of our pharmacists. And then there's some volunteers down there, and I'd love you to come back. Anyone else that wants to come?
But let me suggest this,
Yeah.
that if you got the money, you can cross geographic boundaries.
Well, you know what, I just offered a dentist what he asked for. I had him hooked up with the loan payment, and darn if he didn't go to Charlottesville. That wasn't quite what I said, but it was.
Can't catch them before they step out the door of graduation.
Oh, I had him.
Oh,
He was
you had him?
rotating through our
Wow,
clinic
you
from
did.
VCU, so I had him on the hook.
No, what I mean is you can recruit from North Carolina.
Oh, hey, yeah.
Yes.
Okay, I'll talk to you.
I love this. Already making connections. Perfect. Yes, thank you.
I have a question. Is it possible or to consider doing a chronic healthcare clinic where doctors from Mechanicsville in different disciplines who see diabetes or rheumatoid arthritis or could all be and visit, the patient goes one-stop shopping and sees all the doctors that they need to see as a diabetic on one day, and then the doctors gather at the end of the day and discuss the outcomes and the health care for those specific diseases. Is that a possibility? We did it in Texas when I was there. We did it for children. It was a chronic care clinic for children.
It's a great.
We did it in the children's hospital.
Right. So it's a great idea, and I'll say a couple comments, and then if you have anything you want to add, Landry, about the hospital. But one of the amazing things about the partnership between Tappahannock Hospital now with VCU Health is the access to all the specialty care that's in Richmond. So we're looking at and have processes in place around telehealth in particular to be able to quickly access a specialist in Richmond in real time, out of our community hospitals, as just a starting point of being able to get that level of care here. And then looking at other, how do we continue to recruit and draw from the Richmond team to come out at different frequencies to basically do the same thing that you're speaking to. Anything you want to add about the hospital and specialty care?
Yeah, so I'm Wanda McLaughlin, the Chief Nurse Officer for VCU Tappahannock, and thank you for inviting us out. I wanted to sit quietly because I'm not a native of Tappahannock and really wanted to learn about what you all thought about the healthcare. And from what I've heard so far, it sounds like we need to do more about recruiting. And so although I was in the big city of Richmond, I decided to come to Tappahannock. And I have many, many more years ahead of me than I have behind me. But one of the things that we have to recognize is that the way that you get talent is to make the job look good. And then you do that by making sure that people have what they need, when they want it, and how they want it. So we have to stop thinking about, benefiting the business, but it's about the customer. And so that's one of the things that VCU, Tappahannock, with my help and along with Tyler and the community will continue to do, is to use this assessment from everything that you've said to tell us how to do it. So we're looking for the strategies. We're not looking to tell you, you're looking to tell us about how do we get this. But VCU Tappahannock has expanded its physicians group. We're bringing the specialties into Tappahannock. So if you want to travel a little bit further, just as I did tonight, please come and visit with us. But there's opportunity at Tappahannock VCU. That is my shameless plug. But we do have urgent care, primary care, and some of those specialties that you're talking about. So it's an ongoing effort. We'll continue to do this work. But this is the start of the conversation and how we get it done by hearing from you all. So thank you for doing that.
Yeah, it's a great creative approach that I think that's part of the
One day a month.
right.
The doctor
Yeah.
comes to Tappahannock and
Yep.
sees all the diabetic patients.
It's a great note that I will capture here. So any other general comments about this before I move on?
I think another challenge in rural communities is access to home care, both home health and end-of-life care is a real challenge in rural communities just because of the geography. And we also, this particular community is aging. I mean, it's the average age in our community is very, very high. So there are needs here for people facing end of life. And it's not I know it's not a real cheery subject, but it's a reality of healthcare and provision of care at that stage of life is really important and a real challenge in rural health. So I would think it really should be included in the community health needs assessment. That and as well as education around advanced care planning and goals of care when people are facing life-limiting disease.
I have one comment. I was back there copying, so if I'm repeating something, please forgive me, because I didn't hear. But telehealth is very important when it comes to mental health. And being in a rural area, so many people don't have access to broadband. And those very people are the ones who need to have a therapist readily available. And so when we look at mental health, and I know individuals who are going through telehealth right now, and it's really helping them, really helping them. So I like programs that work. And if we had more capability when it comes to broadband, that's something that could definitely take off in a rural area.
Is it?
If I may throw my shameless plug after that, I've
Please.
been helping connect, because I'm a technologist, I work on a vast array of technologies. I was on the broadband committee across the river, and for right now, Starlink is available. If you need it, get it. It's phenomenal. It is a bit expensive, but almost every broadband is.
What is it?
Starlink. Starlink. It does a phenomenal job. And of course, around here, trees are an issue. You do need a clear sight of the sky, so that, keep that in mind. Alternate to that is cellular broadband. They've been increasing capacity of the towers around here phenomenally. And if you think you're too far out of range, there are great products that help increase the signal. I can help out as well. Look me up, millcreekgeek.com, if you need any help in that area. Because telehealth is very important.
Great, perfect. All right, so as I mentioned this, and as you all affirmed and confirmed, this is a broad list of needs. And so one thing that we've done is tried to kind of reframe the needs and prioritize based on several factors around kind of readiness, resources available, community partners, those sorts of things, and tried to prioritize these needs in kind of in a new way. And so the idea behind this community strategy map is that we're framing our approach to implementation around addressing health disparities to improve health outcomes. As Pastor Williams said, our focus is there's so many clear disparities, race, age, gender, et cetera, that we're trying to approach all of our strategies from that kind of disparity-based lens. So if you look at the left-hand column, you can see those same needs just bucketed in another way. So when we think about mortality together, how do we prevent early death or unnecessary death? Mental health, as was mentioned, chronic conditions mentioned lots here, maternal health, which was also mentioned, and then oral health, dental. So pretty much got everything covered from today. The middle column is, within those disparities, how can we target and reach the community that has the highest disparity, as confirmed by our publicly available data. And so that's Black African American populations and low-income populations. So again, framing our whole approach to this work doesn't mean that we're not going to touch other residents, doesn't mean that our strategies are not going to touch more people, but really being intentional, because we know the health outcomes have not changed for decades. And so how can we do something a little bit different here? And then as you all started to, which I love, start to talk about different strategies, you can see those on the right. It's everything from improving access to education, addressing transportation as a clear barrier, increasing access to prevention, other chronic disease management, and then of course access to care, and that's getting specialists into the community. It's having the right ED access and making sure that we're not sending people to Richmond unnecessarily. So this is kind of another way to approach this. And this is my kind of last slide here. This is just, reframed it a little bit, but when we think about these priority areas, we're kind of taking this dual approach. So you can see two strategies here. One is around how do we increase access to services? So how do we increase, what's the hospital's role? What's our healthcare partner's role? And really helping community members access critical clinical services. And that includes everything from screening, prevention, as well as treatment and maintenance. And then how do we enhance, as a second kind of strategy, community-based support? And that's really where we're looking for your support and partnerships and opportunities. We want to be able to hear from you about where there's great energy. Broadband's a great example. Are there partners that are already in the space working with the school systems, or other places where there's hot spots where we can potentially bring clinical services there? Are there things like that? When you talk about home health and nursing care, are there examples of partners in the community that are starting to get into this space, or any creative ideas? So I know we're coming up on time a little bit here, but would love to hear from you all based off of your experience and knowledge in the community. Are there any groups, we heard the free clinic and that clear follow-up with you all, I think, to explore partnerships there, but other examples of organizations working in the community, of faith communities that are bringing people together that we should be tapped into as we think about strategies over the next few years?
One thing that I think is really impressive down in this general area is our access to YMCAs. We live in Eastville, and the Eastville Y, I've just recently started, we've been members, I've just recently started religiously going. And I think my dues before that were contributions. Anyway, there, great machines there, great programs. The Y over in Kilmarnock has more. I mean, they have an indoor pool, they have all kinds of programs, and it just feels like that's an opportunity that exists, the YMCA.
Great, thank you.
And the Boys and Girls Clubs is a great place to educate, do some educating and cooking classes.
Medical outreach.
What was that? I'm sorry.
I was just saying medical outreach, teach kids.
Oh, through the Boys and Girls Club? Yeah.
Or the Y.
Yeah.
Importance of hygiene.
Amen. I work in a school and that is very important.
Yes.
In there, sister, in there.
I think there would be a way to provide silver sneakers
Mm-hmm.
to all, especially those who have Medicare. All Medicare, include that option.
Wonderful.
I have a question. Are you doing any work with the health department in Tappahannock?
Yes. So the Three Rivers Health District has been on our advisory group for this whole process and been with us and helped around community engagement. We're working with Brendan now as the director to kind of explore opportunities for us to work together to address some of these things. But was there something that you wanted?
Well, I'm just wondering, with all the health departments that are scattered through the state, are you doing anything specific with the health departments currently?
Right.
Or is there something that you intend to do in the near future?
Definitely intend to do.
Okay.
We, as a healthcare provider, have lots of relationships formally with the health department, but really trying to get more towards that grassroots level to impact change together. It's a great suggestion.
Another organization you might want to link up with is, and you may already be doing this, is the Healthy Harvest Food Bank. For well over 10 years, I would say, the food bank has been intentional about making sure that clients receive some high percentage of fresh produce, 40%, so that they're not getting all canned and boxed macaroni and cheese in their diet.
Excellent. Thank you for that.
And there are 14 pantries
Okay.
throughout the 12 counties, I think it is, that are served by the food bank.
Wonderful. Yes.
Following up a little bit on the food pantry, we work in an organization that sponsors a food pantry one day out of each month. And I was thinking about, as you come up with some of the solutions, how do you get that information out to the population that we're wanting to address? And I can see putting, hey, if you're interested in mental health, here's something that goes into one of those sacks of groceries that go into the people's cars to feed them. So solutions are coming up with, I think we can make some strides in helping industry
That's
with
a
that.
great suggestion.
I know that the food pantry in Burgess also provides when they get odd vegetables that are, well, the most popular vegetables, they offer recipes about how you can use those. So when they get them in a bag because the grocery store is donated them, there's a recipe about how they can use it.
That's great. And how to cook it, how to yeah.
I don't think eating it would be a problem.
Right. So what I'll do is there's a QR code if you have the printout. This will take you to like 3 or 4 questions, and basically continuing this dialogue. I also have paper copies of a sheet. As you think of, and that I'll leave, and I can come back and collect them if they're left here tonight. But as you think about other ways and other partnerships and other initiatives or things, great ideas that you've had but just haven't been able to see it through, we'd love to capture all of those ideas. As we mentioned, we're here just to kind of share the learnings that we've gathered through this process, and they're from residents, they're from the community, and know that we have an important role to play as a healthcare provider, but know that we can't do it without our community partners. And so would love to continue the conversation, would love to go a little bit deeper and make some of these things a reality with you all. But anything that wasn't shared that you were dying to share, or any other questions that you wanted to pose to the group?
No, I mean, I don't have any additional questions, but I'm grateful for the open dialogue tonight and sharing of ideas. And if you would, make sure you click on that QR code providing additional information, insight, or gathered information so that you can help us, because our primary responsibility and desire is to hear from the community on how we can best meet your needs. I'm not a medical professional. I'm just one who tries to serve. And I believe that's one of my responsibilities here in the Northern Neck is to do all that I can to help meet the needs of those, especially in healthcare, but in other areas of life. And that's what I'm trying to do. And that's one of the reasons I'm glad I hooked up with Tyler and with Jeannie and Valencia, who's with InterHealth, and Brendan and Virginia Department of Health and what have you, because we're all in this together and we can help each other if we share our individual ideas, because it can significantly impact the lives of other people, even those whom we don't know.
Said it. Thank you all so much. Really appreciate it.